All right, so it shows that we're recording, so I will remember to download that later. And as I said, I've got the chat box open, so I should be able to see if anyone pops in some chat as we're going along. I should be able to see that. What else do I need to do? So I think the first thing is to introduce myself, and then and while I'm introducing myself, if you want to pop in the chat box anything about you, where you are and your interest, that would be handy for everyone to see, and then we can dive right in. So my name's Lesley Dyck. I'm this morning Danielle called me alumni. I used to work for the National Collaborating Center for Determinants of Health. I'm now a health promotion community development consultant. I'm based in the territory of the Okanagan Nation here in the Okanagan Valley in British Columbia, and I want to express my appreciation for being able to live in the unceded and traditional territories of the Sleep people. And of course, it's Orange Shirt Day, so I'm really happy to see a few of us, the ones I can see, have some orange shirts on, so that's great. Thank you for doing that. All right, so I am going to do a screen share oh wait, not quite yet. I need to move my chat off of there, otherwise you're going to see my chat. Let's try that again. Screen share, there we go. And so, okay. So I'm just sharing a simple slide that starts us off. All the groups are going to be starting off with just an open discussion conversation around the resources. And that's one of the reasons why I'm really happy to have Doris with us, because I know that she's used this particular resource. And I've got some other slides if we want to go in and talk about any of the particular webinars or chapters in the book and core competencies for health promotion. We can go into those as well, but let's just keep that slide up as reference. Anyone who would like to go on camera, we'd love to see your face as you're chatting. I'm happy though if you want to keep your video off. Although do please try to mute yourself in between. And if I see you're unmuted, then I'll assume you want to say something and I'll make some space for you to jump in. So does that sound good? Anybody want to use their little sticker at the bottom? At the bottom you've got a little thing where you can do a thumbs up. Yes, Lisa's got it. Thank you, Lisa. We're all okay? Thumbs up. You can do a real thumbs up too if you want. Excellent. Thank you. Okay. Okay. So what we really want to do then, as people are introducing themselves, saying hello. Thank you for the folks that are jumping in to say hello here. Really appreciate it. Some people in my neighborhood as well. It's great to see that. Well, my neighborhood, Kamloops, so close. So if everyone can take a look in there, that would be great. Yes, hi, Bronwyn. Yeah. All right, so let's just start with some questions then. So this particular resource, any questions about the topics that are covered in this resource or how this resource can be used? Any kind of high-level things before we kind of dive into asking people to share their experiences?
I have a question about how the resource can be used.
Sure.
So I haven't used it before, but in our area of public health, we have what's called caring way teams, and it's essentially the public health staff that work with community to do different projects that are appropriate for their area. And sometimes when I find resources, I'm trying to learn when is appropriate to share with the entire team to do, like what might be beneficial for everyone, or maybe what's just helpful for me. So I'm wondering, is this a webinar series that you feel would be helpful for all public health staff that are doing community work?
Right. Okay. So you called it a care from away?
Caring way? Like
caring way.
Yeah, sorry, I'm probably mumbling.
Yeah, no, that's fine. Caring way team. Okay, good. Thank you. I wanted to make sure I got that because I hadn't heard any teams described like that. So yes, so the short answer is yes, this webinar series was designed to link the theory and the practice. So every webinar has generally the chapter author, so the person who wrote the chapter in the textbook, and then the second part of the webinar is a practitioner. So, you know, for example, when people may be familiar, because you're interested in equity, I'm assuming, familiar with Dennis Raphael from York University. So he wrote the chapter Implications of Health Inequities for Health Promotion and Public Health, and that's chapter 8 in the text. And then we had Shanak, who worked in public health in Antigonish, Nova Scotia, and she then responds to that from the perspective of a frontline public health nurse. So all of the sessions, you know, have that kind of a balance and representing health regions and from across the country, healthy communities in BC. If you're working in BC, the Healthy Communities Initiative was represented. We had, for one of the webinars, we had Downtown East Side, Vancouver, a collaborative down there talking about participatory practice in health promotion at the level of street involved service. So yes, the short answer is yes. Yeah, good. Any other kind of high level questions? I'm going to jump over here to the text box. Emergency resources for nonverbal autistic students. Yeah, that's very specific. If you want me to hook you up, email me. Thanks. Okay.
Sent to the wrong person. Sorry.
Oh, did you? Oh, okay. Oh, it wasn't supposed to be for me. Okay. Good. No worries. Okay. So, if there's no other high level questions, I guess my next question is, who here has used any of the resources, and what I would, well, how best can you indicate that? If you've used one of these webinars, do you want to just go down to the bottom of your screen and choose your icon and give me a thumbs up? Nobody. Although Doris, you've used the actual text, right?
Yes, I have, including the webinars.
Oh, you have. Okay, so that's one thumbs up, Doris. All right.
I'm not sure where the thumbs up is. Sorry, I'm not familiar with Zoom.
Okay, yeah, that's the dilemma, especially if you're used to Teams or something like that. It tends to be on the menu bar on the very bottom of your screen. There's a little right-hand side reaction. Yeah. Oh, there you go. Perfect. Excellent. Okay. Thank you. Okay. So then maybe Doris, I can just ask you to talk about the experience that you've had with this resource. That might be a good way to launch.
Okay, sure. So I'm now in Vancouver, but I'm originally I live in Antigonish, Nova Scotia, and in the spring and then again in the summer, I taught a course that was part of a new adult education for health professionals master's program offered through the through St. Francis Xavier University. And so this was the first run at it, and I taught the course that was on health issues, in health education. And I had taken the Master's of Adult Education years ago when it had a different kind of approach. I should say my background is health promotion and nutrition, and I had taught in the human nutrition program for a number of years at St. So this was a whole new kind of experience with a new course. And the first cohort was offered in April, and it was to health professionals. Most of them were in Nova Scotia and this is all online, most in Nova Scotia and a couple from PEI. And I have to say it was right at the peak of the pandemic. And it was a very stressful time for these health professionals who are working. Many of them were in clinical frontline workers, a few in public health. So one of the things that struck me is that a lot of them didn't have much background in health promotion. And also the name of the course was Health Education. So we started off by really trying to shift the pendulum a bit from the notion of health education to health promotion. I used the textbook. I was quite familiar with it in the earlier editions as well. And I used the webinar as another piece of this puzzle is that the course was condensed into 6 weeks, 3 hours per week, 1 night a week of online synchronous learning, and 3 hours per week of asynchronous learning, which meant they had things to do outside of that. So I found the webinars actually really useful, particularly when for the asynchronous work. So that a chapter could be read as part of preparing for the course or for the week's discussion, but also the asynchronous work in terms of looking at and watching and addressing some of the critical questions through the webinars was really useful. The other important thing to note is that I felt that Health Promotion in Canada was a really useful book because it started off by looking at frameworks, concepts, key concepts in health promotion and the evolution. And it carried through with key concepts around the Ottawa Charter throughout. So that was the first part. The second part was really about health promotion in practice, looking at a number of wonderful chapters written all by Canadians who really talked about current practice, debates in practice, and the concepts and tensions within concepts, but very much grounded in practice, including clinical care, which was useful to actually acknowledge that health promotion has a role in clinical care among clinicians. And also the last part was critical reflection. And of course, this was a Master's of Adult Education, so critical reflection was really key throughout. So I used the webinars as asynchronous learning for them to watch and engage with on their own time. And then I had a forum, and particularly I tried this out in the second round in the summer, a discussion forum where they would talk about ideas that came from their practice, but as it related to concepts and ideas that had been discussed, that were in the book, in the readings, discussed in class, and also through the forum. So the webinars. The webinars really provided a really good connection with the text, made it real, and got them to actually know some of the authors who were involved in practice and in the content of the text.
That's great, thank you. And that was the real intention behind that. So I put up on the screen just a brief summary of how the chapters are broken into 3 parts, and then the format of each part with the critical thinking questions. So Doris, I guess a question for you that might be of interest to the folks here, because we only have a couple minutes left, is then what do you think about this being used in the practice setting? So if you're a public health nursing manager and you want to build capacity of your public health staff, what would you say about using it in that context?
I think it actually could be well used. And I actually had a number of guest speakers come into the synchronous class, 3-hour class during the week. And one actually said that, and she was addressing health equity and works in that area. It was Christine Johnson. And she said that it was so refreshing to see the clinicians who have a limited understanding and of health promotion, but actually becoming quite engaged in the notion of their practice having implications for health equity and how things could change. And that was something that I noticed throughout the whole course, is that I had students from a totally diverse range of health professions.
Mm-hmm.
Pharmacy, some in public health, but many of them more in clinical practice. And it was the first time they had ever really been engaged in this kind of thinking.
Mm-hmm.
And so I think it works very well, because the text and consequentially the webinars really are addressed to practitioners. They speak about from practitioners about academic practitioners / about key aspects of practice, and they really do move the pendulum, I think, in terms of learners.
That's great. Thanks, Doris. I appreciate that. So this group, I mean, you are obviously working frontline public health. Oh, thanks for the thumbs up, Kimura. That's great. You're working frontline. I'm just curious, can you share any experiences you've had, maybe not sharing this resource, but webinars in general? Like, how have webinars worked with you? Yeah, I got a thumbs up from Marzier. Thank you. I know my accent maybe is not quite in the right spot on that. Can you go ahead and unmute and just, share a little bit around how use of webinars? I mean, these webinars tend to be broken into segments, by the way. They're hour-long webinars, but they have generally between 10 and 20-minute segments, so that the intro is 10 minutes and it's broken out, and then you've got the main author that's usually about 20 minutes, and then you've got another segment that's the practitioner who's doing a presentation. The NCCDH has done a really nice job of kind of breaking them into chunks so that you can use the chunk that's most relevant to you. But yeah, just unmute, and anything you can say about your experience using webinars. Good, bad, ugly.
I like how practical they are for integrating it into my workday, because some days I have more time than others. So if it's a webinar, I can get maybe 2 sections in one day, one another day, and finish it off whenever I can.
Oh, yeah, so self-directed learning, it's really working then. Yeah, great, thanks, that's a good example. Any other examples? Just go ahead, unmute. And feel free to talk about any times the webinars recordings are not working for you. That's good. That's good to know.
I can go. So hi everyone, nice to see you all. So I really like webinars because I tend to be a multitasker, and sometimes I have to do mindless jobs, like filling up spreadsheets, and so I can just put on a webinar and just do this type of job. So, and also this is something I'm doing for my professional development. So sometimes you don't have extra time in your schedule, and when you have a webinar, it's much easier to integrate.
Mm-hmm. Yeah, that's great. Anyone want to comment on, so one of the really valuable things certainly is the textbook itself, but it is a textbook. It looks like it has the weight of a textbook. Any thoughts, like if you were going to use this with your staff, or would they be willing to buy the textbook? Would you be able to have the textbook in your office?
Can I speak to that?
Sure.
I know it's really differs with the context in which you're working, but some of the feedback I got, I mean, it's such a rich resource in many ways, but there is so much information in it. Mm-hmm. And I think that was feedback I got from this course that I was teaching, which was really condensed into 6 weeks. And the learners had so many competing things happening in their lives that, it just wasn't realistic. So the webinars really did help because it captured their interest for that time. And there was so much, almost so many gems in the text that you can get overwhelmed by it if you are working and you have to be really quite careful about how you balance your time. So I think that's one of the values of the webinars as an asset for
well, and that really, yeah, that really speaks to the challenge we had in designing the webinars, helping the chapter author narrow to a specific piece because the chapters are so huge, and then finding the right practitioner who could speak to the experience of implementing that particular part of it. So that's one thing to know is the webinars, even though it relates to the chapter, it doesn't cover everything that you can find in that chapter. Yeah.
It has wonderful nuggets though, and then it can be enticing enough to take somebody back to the chapter to read it. But in many ways it does stand alone for the purpose of a practitioner and what they need.
Yeah, that's great. Good to know. I know that we're going to get pulled over into the main room. I'm sure Danielle will send us a message in a second and then boop, we'll be gone. So just any other reflections? I've heard you talking about from your own perspective, professional development. Are any of you supporting others in their professional, well, besides Doris, obviously doing as an instructor, anyone else supporting others in your unit? Any reflections around, how you might use this? Does anyone have this textbook already? Okay, because I've often wondered if that's a barrier. Oh, Bronwyn, are you going to unmute? No, you just came back on. Okay, I was like, oh, great, Bronwyn's going to say something. All right, and I guess the other thing that I would mention, and maybe I'll skip over to a slide. So this, yeah, you don't need to see that slide. It's all the webinars that we have. We don't have all the chapters. So, actually, maybe this is something that I should ask. If you do get an opportunity to take a look at the table of contents, which you can find online, even if you don't have it, if there's particular chapters that you think are really interesting and exciting that you'd love to have webinars related to, don't hesitate to let me know. So I'm a volunteer with Health Promotion Canada, or let the National Collaborating Centre for Determinants of Health know, because that will really help us think about because we've got an agreement to do some more webinars, so we need to figure out which chapters, which topics might be of interest to people. So how about that? That's your homework. If you could, when you leave this webinar, if you could take a look at that. So, okay, I've just got the little note that we're going to close in 5 seconds. So it was lovely to see all of you, meet all of you.